Day class. In this video, we are going to study the facial paralysis. The most typical symptoms of the facial paralysis is the patient's mouth move to one side of their face, or one side of their eyes could not close, and also one side on the same side of the forehead they couldn't move, or the eyebrow they couldn't move. So these are very typical symptoms from here. For example, the wrinkles you don't see from this side, and also you can see the eyebrow is not on the same level because this side could not move. The mouth will move to one side. Also here it's not even. U26 水沟 it moved to oblique to one side. Deviated. Also from here, you can see deviation. The strength of the eyelid also weaker. What's facial paralysis? It is the total loss of the voluntary muscle movement on one side of the face. It is caused by the acute, non-provident inflammation of the facial nerves in that region. So, more commonly, the patient will present on one side. This definition is actually the explanation from Western medicine. In Chinese medicine, we more focus on the deviation. The definition is more focused on the deviation of the face and eyes. The most common medical conditions is the Bell's paralysis. Facial paralysis from conventional medicine mostly they refers to the infection or inflammation of the facial nerves. But we need to differentiate with the other diseases, especially the diseases that's related to the head and brain. The head trauma affected the brain. The head or neck tumor, the stroke. All these diseases may present as facial disorder. So when you see a patient present as facial disorder, you need to differentiate. You need to exclude these three diseases, especially the tumor, something related to the central nerves, something related to the brain. Now, how to differentiate? There's one very typical symptom from the facial disorder, such as a stroke. The patient also may present as facial disorder, or the tumor in the brain. Sometimes the patient also may present as the facial disorder. This type of facial disorder normally affects the forehead. The facial paralysis will affect the forehead. The facial disorder apart from the forehead, the wrinkles, they won't affect the forehead. Mostly, it will present in the low quarter of the face, which means only below the eyes, on one side below the eyes. For the facial paralysis, the patient will present as the problem in the forehead, the eyes. We mentioned previously, the most common medical condition for this problem is the Bell's palsy. Bell's palsy can occur at any age, more commonly from 16 to 60. The etiology. We focus on the wind because the main presentation of the facial paralysis is the deviation. The deviation of the face, the deviation of the eyes. So the deviation is something moving, that's something related to the wind. And also apart from the presentation, many patients, they will have a history of the wind. So sometimes when you ask the patient, how did it happen? Or what were you doing before the disease onset? Very commonly, the patient will tell you that they were driving for long term. So long driving, especially leave the window open because it's very hot in the car. So they leave the window open, they drive for hours. And then once they arrive at the destination, all of a sudden when they drink water, they feel that the water coming out from the mouth. And all of a sudden they realize one side of the face could not move. Another very common situation that the patient may have a party with the friends in the evening, the day before onset, in the late evening, and then they boil outside and they drink in a windy weather, and when they sleep, they leave the window open. The second day, the one side of the face cannot move. So when you ask the patient, many of them will have the history of experiencing the wind in environment. So that's also another reason why our treatments will focus on the wind. It may be wind cold, it may be wind heat, like in the Yangming and Shaoyang meridian. The Yangming and Shaoyang meridian is because the Yangming, the location, the distribution of Yangming and Shaoyang meridian is where the facial paralysis presents. Pathogens affect the meridian and cause stagnation or malnourishment of the affected area. Apart from these, the wind, what other factors do you need to think about? This is also the thinking from the etiology. Whenever we talk about the etiology, we always think from the exogenous and exogenous. So the pathogens that we have mentioned now, the wind, we also need to think about the antipathogenic qi. Why you had a party with your friends, of them, you are the only one suffer from facial paralysis. Others are perfectly fine. You were in the same environment. The only difference is the body constitution. So that's the antipathogenic qi. That's why in our treatments, apart from focusing on wind cold or wind heat specific pathogens, apart from the wind, you also sometimes can see the phlegm or dampness. So these are just as examples. You can see you need to analyze from individual cases to case. Okay. So apart from the pathogens, you also need to focus on the antipathogenic qi. So you need to strengthen the body constitution, to strengthen the antipathogenic qi so that the pathogen won't attack the human body. So we always think from two aspects, the pathogens and the body constitution. For facial disorder, the facial paralysis, we're going to divide into different phases. The acute phase within 7 days, from day 1 to 7 days. Early recovery phase, 8 days till 1 month. Late recovery phase from 1 to 3 months. Sequela phase, more than 3 months. From the phases, you also will see that the best recovery will be from here. After 3 months, you still may try, but the recovery won't be as good as in the acute phase. So for this problem, also the sooner the better, but we have to emphasize that in the acute phase, within 7 days, we will never use the strong manipulation. So you have to use light manipulation or even avoid the area on the face. So if you can, but if you want to be safer, you also can select within 7 days With your treatments, you can focus on the distal points, not the local points. If you choose the local points, don't manipulate too much. You leave the needle there for half an hour, that's all. From the early recovery phase, though, you can have the manipulation. You can start the manipulation. The common manifestations, abrupt onset, so it happens all of a sudden. Deviation of the mouth and eyes, drooling, difficulty in eating and drinking, difficulty in making facial expressions, the weakness on the face, especially on one side, the muscle twitches, dry eyes, dry mouth, irritation to the eye of the eyes, sensitive to the sounds, tinnitus, and sometimes the patient also may experience the pain or ear ache, or sometimes the ache just right behind the ear. So the front parts, the first few symptoms are very typical. If you see the deviation of the mouth and eyes, everyone will know this is the facial disorder, the facial paralysis, or Bell's palsy. But sometimes if you see a patient presents irritation of the eyes only, or sensitive to sounds or tinnitus, or the pain behind the ear, you need to be careful, especially if the patient presents as irritation of the eyes or the ear pain, the ear ache, accompanied with the muscle twitches, especially on one side. You need to be careful. This patient may present as the early stage or the mild symptom, the mild facial paralysis. So if you apply the treatment at this stage, you will achieve the best results. Sometimes the patient may recover only from one session. So apart from the typical symptoms, we also need to be careful of the untypical symptoms. This is very easy to cause misdiagnosis. I saw one patient come to me after 4 weeks. The reason why she only came after 4 weeks because she experienced the irritation of the eyes at the beginning. And then the doctors said that's the allergy. The allergy is she was prescribed the eye drops for 2 weeks. Doesn't work. The irritation is still there. And then she was referred to the specialist. And at that time, she experienced the ear ache and with tinnitus. So she went to the ENT specialist. They thought that was the inflammation from the ear. She was prescribed the drops again to the ear. Still didn't work. And then when she came to me, apart from the irritation of the eyes and the ear ache, she experienced slightly muscle tissue. So sometimes the face twitches 1 or 2 seconds. And then when she came to me, I said that more commonly it is the facial paralysis. So we have the treatments done. And in this situation, she was delayed for 4 weeks. When you see from the slide, the previous slides, after 4 weeks, that's almost goes to the late recovery phase. So this patient also recovered quite well because she suffered from the mild situation, not the severe, the typical and severe condition. But another patient also suffered from the irritation of the eyes, but in the meantime, she presented as muscle tissue on the face. On the first day, we have the treatments, and only with one treatment, she recovered. So from these 2 cases, you will see the time when accept the treatments is very important. The earlier, the better. And the syndrome differentiation, the wind cold, wind heat, qi and blood deficiency, especially after long term. in the recovery phase or sequelae phase. Apart from the treatments on the face, you need to focus on qi and blood to tonify the qi and blood. The treatment principles to activate the qi and blood circulation and block meridians. We can use a combination of acupuncture and moxibustion. The main points focus on the local points and the foot yami meridian. The foot yami meridian is because the foot yami meridian distributes on the face. So the points that we can select: GP14, stomach 2, 三焦 18, stomach 6, 三焦 stomach 5, 三焦 17, large intestine 4. Large intestine 4, we will use the opposite sides. So if the patient presents from the left facial paralysis, we will use the large intestine 4 on the right side, so opposite sides. That's because of the distribution of the large intestine meridian. From one, it goes all the way to the mouth and ends on the other side of the nose. So this one, the opposite sides. Due to wind cold, you can add GP20. Wind heat, you can add large intestine 11 to clear the heat. With difficulty in moving the eyebrow, you can add bladder 2, deviation, U26. U26 is the bird packing technique. We have introduced in the practicals for U26. What we need to do, we need to use the technique, the bird packing technique, till the patient hear a little bit or the eye become watery. Shallowed nasolabial folds, large intestine 20. In the recovery stage, you can add stomach 36 to tonify the qi and blood. These points, you don't use all of them at the same time. You can select, especially for the treatments. If you treat the patient every day, even twice a day, if you treat this patient, you need to put them in groups. 2 groups. You're going to use this group 1 and group 2 alternately. Different technique, even manipulation approach. Moxibustion you also can use. Light manipulation should be applied in the acute stage. The light manipulation in the acute stage refers to the points in the local points. The distal points you can use strong manipulation. Large intestine 4, even manipulation. Stomach 36, reinforce. You also can add moxibustion. U20, pericardium 6, you can use. Spleen 6, stomach 36, to tonify the spleen and stomach. Other treatments, the skin needling, cupping. Cupping you also can use, especially if the presentation is more present on superficial level. So the case we're going to introduce, why I apply cupping at the end is because after almost 10 days treatments, I can feel that the patient, the muscle is moving. The muscle is actually moving, but the face still doesn't move. So in this situation, I will apply cupping after the acupuncture. Electrical stimulation only can be applied after 1 week, so don't apply this in the acute situation, in the acute phase. Scalp acupuncture you also can use. So this you need to focus on the affected area. It is very important to give instructions to the patient how to prevent become worse. So you need to give instruction to avoid windy or cold weather or environment. So the patient is suggested to wear in the facial mask And also normally what I require is the patient should not let the wind to blow to the face directly. For example, in summer it's very hot, and if the patient sits in the room with the air condition, the wind should not blow to the face directly. Or when you're driving a car, the air condition, the wind, the fan should not blow to the face directly. You can make the environment cool but not cold. You can make the environment cool, but the wind should not blow on the face. Okay, this case, a patient, male, 19 years old. The first consultation was on 26 July. 3 days ago, the patient started to feel tingling on the right face with no obvious cause. So this patient doesn't have any. This patient could not recall any possible causes. And also at this stage, July last year, that's during lockdown, there's no activities at all. He didn't seek for treatment because it's only mild, the tingling. 1 day ago, yes, the day before the treatment, he realized that he could not move the right facial muscles, leaking air when puffing up cheeks, leaking water when drinking water. No headache, no running nose, no nausea, no vomiting. Why in the present history I need to write all these the negative symptoms? From these negative symptoms, I can see that this patient didn't catch a cold before the facial disorder. So we don't write randomly. You need to know why you need to write the negative symptoms to exclude the diseases that we need to differentiate. Like red tongue with dry, thick white coating. The thick white coating in the center is the middle jaw. So on the first day when I see this patient, the eyebrow, the wrinkles here, the deviation of the mouth, both sides is not even. The force of the eye is after the treatment. When you see the recovery, you see the deviation. Also the mouth, the deviation of the mouth. It is very important this treatment, most of the situation, try to use the fluid needle, the more the better. So that's the technique we study in the practicals. One needle, you needle to several directions. For example, this one, Yang Bai. Before I remove the needle, I will needle to different directions, to 传足, to 童子疗, even to 头尾. That's the four directions that we have introduced. The 太阳, 颊车, 下关, all three needles. But this points, stomach 4 or 6, 地仓. This needle is a 3-thread needle all the way to 颊车. This points, 承气, 400. The stomach 区, 400. There's also 2-thread needle all the way to 地仓. Before I remove the needle, I'm also going to change the direction to 迎香, to large intestine, to 颊车, to 下关. So, as you can see here, for this patient, I don't use many needles. I didn't use many needles. Only 1, 2, 3, 4, 5, 6 behind the ear. Only six needles in the local region, but I actually use a lot of points. This point is very important. This point is 签证. 签证, the Mandarin, the name of the Mandarin means pulling straight. Because of the deviation, so we need to pull the face back. So this point is something you can use. Also, some patients present as the earache just behind the ear. So this is also the local points of the earache you also can use. The insertion for gentle is perpendicular. From the rest on the face is oblique or even horizontal. Use the through-in needle technique. On the first 7 days, don't use the strong manipulation on the face, but also we need to tell the patient for this situation, if the patient comes to you from day 1, you need to explain to the patient, you need to continue the treatments. However, you may not see any improvements within 7 days. The improvements you may start to see improvements from the 2nd week. Otherwise, the patient will come to you for a few days and then they stop. They seek for the other practitioners. They can go to the other practitioners, but you actually delay the treatments. So we need to expand to the patient. In the acute stage, because the disease is still progressing, then the purpose in the acute stage, although the disease is still progressing, why we need to treat at this stage? We need to reduce the severity of the disease. So if we apply the treatments in acute stage, the disease may progress not as bad as it's supposed to be. That's why it's very important to apply the treatments. The sooner the better. In the acute stage, even in the recovery stage, we will apply the treatments once a day. 30 to 60 minutes. Number 36. Strengthen the qi. You also can use the points on the abdomen to strengthen the qi. After a few days treatments, this patient, the muscle recovered, but the face still couldn't move. So when I palpate the muscle, I ask the patient to bite the teeth. I can feel both sides the muscles was moving, but the face still didn't move. So what I was doing is to apply the cupping. Apply with the skin needling technique. The skin needling technique, you can use this kind of needle for a few minutes till the patient presents a slightly red on the face. You can see slightly red on the face. And afterwards, we can use the cupping. When we use cupping, it's very important that we need to be careful of the fire. Also, apart from the fire to the lungs, also don't get the patient, make the patient get burns on the hair. Because the cupping, that's the one we leave on the face, will leave the dark mark on the face. That's the facial paralysis. It's because on the face, we don't want to leave the mark on the face. So we more commonly, we use this kind of technique. The reason why I need to change the cups is because after a few times, the cups become too hot, so don't make the patient get burnt. And also, when the cups become hot, the suction is not that strong. That's why we need to use a few cups. In this video, we have introduced the facial paralysis. From the study, we need to understand the definition, the etiology, and how to prevent as well as how to treat the problems. The case study. This case is a very typical facial paralysis case. The typical case not only from the presentation, although this patient was a typical case from the presentation, but also from the treatment point of view. So I apply a quite comprehensive treatment, including acupuncture, Moxibustion, skin needling technique, cupping. We don't always apply the comprehensive techniques on every single patient, but we will apply different techniques according to individuals. So the techniques that we introduce in the videos, you may apply, you may or may not to use them. So you don't have to use the full comprehensive techniques. This patient, after the treatment, recovered on the almost on the 20th days. So almost after 3 weeks treatment. It's also very important. We need to understand the diseases. This disease, in the acute stage, within 7 days, you won't see any improvements. So don't stress, don't panic yourself, as well as we need to explain to the patient well. Also, we need to give the instruction to how to prevent. The patient also need to keep warm. In the meantime, then another technique that you can suggest the patient to do is the massage. The massaging from the mouth to the ear, only from one side. So pull the muscle, pull up from the mouth to the ear, then pull back. So once, pull from the corner of your mouth to the ear, one, and then relieve, and then pull again, and relieve, then pull back to the mouth. So that's the massage or trainer in Chinese medicine that we can apply, we can instruct the patient to do. Acupuncture to treat the facial paralysis is quite effective, especially in the acute stage. When we treat this patient, we need to differentiate with other diseases. That's very important. Try not to mix diagnose. Thank you for your attention.